in Columbus, Ohio. So I wanted to talk today about positioning and what we teach as far as bracing when you're doing movements like a squat, a deadlift, any type of hinge type movement. We do use a belt a decent amount of the time. We have people that don't use a belt, but we use this as kind of a training technique in order to really focus on gaining that intra-abdominal pressure and focusing on bracing. So I'm sure you've heard, when you use a belt, you hear people use the terms like set your stomach into the belt. What happens a lot of times is when people are taught to set their stomach, is they end up just pressing into the belt with the anterior part or their abdominal area. So you try to set or brace into the belt, but what you miss out on is some of that expansion into the back, which is probably the most important aspect of creating that intra-abdominal pressure. We talk a lot about that extension-based patterning that we see of hyperactivity in the spinal erectors. What we want to try to do by expanding more into the posterior wall is expand those erectors and create more of an efficient, stable base. So in this position, what Zach's going to do for us here is when he thinks about bracing and expanding into this belt, we've placed a towel, if you can see, turn just a little bit here. We've rolled up a towel and put it in the back of the belt. He's going to think about smashing this towel into the back of the belt when he breathes in and braces. So go ahead, take a big deep breath in, brace into that belt. And you can see he's actually opening this area up by trying to smash the towel into the belt. We would do some accessory work from this. You can see he's holding a kettlebell in a gobble position. We do some lightweight really working on that expansion. You can start to work your way up. Obviously, if you're someone that doesn't use a belt, this is just to get that feel and cueing. But really focus on not only expanding out into the anterior part, but really all the way around in a 360-degree manner, especially focusing on expansion into the back or posterior segment. So if you guys have any questions, feel free to reach out. Make sure to like, comment, and share this. Appreciate it.